All right, everyone, welcome to our first Wednesday webinar of 2025. I'm Gregory Zengo. I am the Medical Director of Practical CME Medical Training, and I'm also a board-certified OB-GYN. Delivered my last baby over 20 years ago. I did get out of OB fairly early in my career. I used to be on faculty at Emory University, both as an assistant professor at Grady Hospital for the residency program, and then a clinical professor for the next 10 years afterwards. In 2008, I founded Practical CME Medical Training because we needed a good, rigorous, evidence-based way to learn all of these new aesthetic and wellness services that were starting to become popular. And part of that was researching and writing the first ever CME accredited cosmetic platelet-rich plasma and microneedling training course. Those modalities were bundled back then in 2014. And the reason for that is at least in the physician community, microneedling was presented as a way to drive PRP into the skin. And how we've come a long way since then. We're not just using it to drive PRP into the skin. We're using it to drive all kinds of fantastic topicals into the skin, with the newest and probably the most exciting topical being exosomes, which we're going to talk about tonight. So it's come a long way. The microneedling course is now a standalone. It's an amazing standalone procedure, whether you're an MD, a nurse, a PA, a nurse practitioner, to get the full capability out of microneedling, to use it on scars and use it for pigment, use it for anti-aging. You need to have one of those licenses. So what we are doing tonight is giving you a little bit of a taste or an excerpt about exosomes. And one cool thing about tonight is that this is pending being included in the CME course. We are putting the final touches on this content, so you're getting a preview of it. Kind of like when I went to that REM concert years ago and they played songs from their next album that nobody heard yet. So that was kind of cool. Well, that's what you're getting tonight. Maybe not quite as exciting, but it is to me. And the course that we're going to be talking about that you can purchase only through DP Derm, and the links both to the course outline at Practical CME and to the purchase link are all going to be found in the Q&A section of Google Meet. That's down on the bottom right where you see a triangle, square, and circle. Click on that, click on Q&A, you'll see those live links and you can read all about it. But I would strongly suggest getting it because you will be connected to me and to all of the research behind microneedling for the next 2 years. You'll have 2 years of access with free updates and that a very important 3 CME credit certificate for which you can then send off to your professional liability carrier and tell them that you now have CME certified training, and hopefully you'll be able to negotiate a discount in your rates. Other precautions we want to talk about, and next week's webinar will be devoted completely to the government and FDA clearance and what clearance versus approval means and all that stuff. So that'll be fun. We'll save that for after Inauguration Day. But microneedling does have an FDA status. It's had that status since 2018. Devices need to be cleared. And there's an FDA website for which you can look it up. But if I'll make it easy for you. If you're not using one of these 6 devices, you are not using an FDA cleared equipment. And if you're using that in trade, oh boy, you can get in trouble. So, and frankly, if you're using 5 of the 6 on this page, you could do better. And so keep that in mind. The equipment, of course, we're talking about here, which I've called before the iPhone moment for microneedling, is the DP4 pen. It's the only one with a digital direct drive. It's the only one that actually pushes the needles into the skin and pulls them back out, just like a champion cyclist in the Tour de France clips their feet into the pedals and they push down and pull up at the same time to get more energy delivered to the gearbox. They also have the industry cheapest needle heads at $26 a treatment, but they're also industry best. And you're getting 16 needles and a very reasonable starting price and fantastic depth to 3 millimeters or more. In every aspect, this pen is the best. And it has revolutionized my practice since I purchased it in late 23. And just like you have the iPhone, you also have the App Store. And the App Store is where you get the topicals, which we're going to talk about in a minute. But one of the things, if you're not doing microneedling, realize that the holy grail of anti-aging medicine, especially care of the face, is to create healing without injury. There's lots of things we do in our lives that creates healing with injury, and that's sun exposure every day, and for which we tend to not use sunscreen, not protect ourselves. There's heat in the form of lasers and RF devices, which can create a healing response or collagen remodeling or skin tightening or whatever the salesmen want to call it, but it's still damage, and microscopically there is still scar tissue. The things you want to avoid when you injure the skin in the healing process is inflammation, infection, and of course, scar tissue. Inflammation and infection can lead to scar tissue. Heat can lead to scar tissue. So can cold. So can trauma. So all of these things you see here, yeah, you're going to get collagen remodeling, but eventually you're going to have a face with full of scar tissue, and you have to hope that the scar tissue is prettier than what you were born with, and that is a bit of a stretch. Healing without injury is what microneedling gets you, and just like you have the device, which is the hardware, the iPhone, you have the App Store where you can purchase products that are designed for needling, meaning if you put the wrong products on the skin, if you've got perfumes which are irritated, if you've got artificial colorings, if you've got strong acids, and you create a bit of a scar or an inflammation response, you could end up with more pigment. Or instead of breaking down scar tissue, you could end up with it being replaced by new scar tissue. So healing without injury is microneedling when done at the right depths, on the right prepared skin, with the right products. Okay, and that's really important. And that's, again, why we have the training course. So what can we put on the skin during microneedling that will enhance the effect, enhance healing, which in a way, healing on something that's not injured is anti-aging, right? Because the skin over time thins, the collagen content decreases, the amount of elastin decreases, the amount of hyaluronic acid to plump the skin decreases. So if we can deposit more of that without creating an injury, then we have a very effective procedure. Now, we've been able to achieve that with the growth factors derived from blood platelets called PRP. We can also do it now with similar growth factors packaged into exosomes. You can do it to a degree with shallow peels or other more superficial exfoliation, but you're just not going to get, you're going to get that exfoliation, but you're not going to get that impact into the dermis that you can get with microneedling. So topicals are half of the benefit of microneedling. They could also cause damage, again, like I said, if you choose the wrong ones. The needle channel healing response is the other half. So if you basically microneedle at the proper depth and the proper time intervals through some inert glide, maybe you choose something like glycerin, for instance, that has no, medical benefit, you're going to get half of the benefit because you'll get the channels, you'll get the channel healing, but you're just not going to get the full potential response than if you work product into those channels that can bypass all the barriers of the stratum corneum and get directly to the fibroblasts and the adipocytes to achieve the effects we're trying to achieve. And the topicals are there to support the scarless healing process or to support the metabolism of pigment, the emptying of the keratinocytes, and the downregulation of the melanocytes. So there's lots of things that these do for us, but they should all end up with the same goal, and that is scarless healing, healing without damage. And so one of the first great ways, synergies, to get that topical growth factor benefit was using something like platelet-rich plasma. When you look back at the medical literature, and I think our second webinar, we talked about PRP more in depth, but the early 2000s was mainly microneedling using various vitamin serums, and the 2010s, we investigated using needling with PRP, and now in the 2020s, we are branching out further and investigating exosomes and other things. But the point here was that you could draw PRP. It had an FDA status. You could process it in FDA-cleared equipment. You could put it on the skin topically to help with scars or to help with scalp and hair follicles or general vanity. But you could also inject it because it had that PRP status. It was autologous. It was sterile. It was handled properly. You could also inject it. So you had the benefit to work on contours and deeper in the skin, but also superficially. And one of the reasons why it worked is what's in this yellow circle, and that is all of the growth factors. So platelets don't just clot blood. Platelets actually initiate a healing process. Now imagine if we could have healing without injury. Wouldn't that be amazing? Wouldn't that be the perfect way to turn back the clock on the skin? And of course, one of the questions that was asked 20 years ago was, can you create an abnormal tissue response? And the answer is, no, you can't, unless you overdo this or unless you introduce the wrong things into the skin that create inflammation and infection. So we talked in prior studies about how needling through PRP and basically delivering these growth factors could help treat acne scars over time better than just microneedling alone. So now that brings us to exosomes, which have started to make their way into aesthetic medicine. And basically, the way you want to look at an exosome is that it's a small package of growth factors, similar in a way to some of the growth factors that are in platelet-rich plasma, but are packaged in a non-immunogenic vesicle that are extraordinarily small, that can then release those growth factors without having to draw blood and process it in FDA-approved equipment. So exosomes, though, have to be derived from some kind of parent cell. So let's go over a couple pictures to show you how that's done. I'm actually going to skip ahead here. So you have the parent cell, and apparently these parent cells, depending on where they come from, especially if they're more immature, amniotic cells, things like that, cancer cells too, if you actually look in the literature, make a lot of these extracellular vesicles, and they use them for communication. And so these extracellular vesicles, or exosomes, are not functioning cells. They don't have a nucleus, they don't have mitochondria, they don't have organelles, but they do have packages of proteins and growth factors. And you can take these vesicles and package them any way you want. You could package them into special wound healing dressing for burn patients. You could package them into an injectable hydrogel. However, this is only experimental for now, and you don't want to do this in the US. You can use them for 3D bioprinting. You can use them in microneedling arrays, or you can use them topically with microneedling pens. So what you see in this extracellular vesicle is a coating that does not trigger an immune response in the host. And that's really important, because the more of an immune response you get, the more likely you're going to end up with potentially pigment and scar tissue, like I said, and you want scarless healing. So I want you to focus more on this upper right part, the VEGF, TGF-beta, fibroblast growth factor. These are identical to what we see in platelet-rich plasma. And so without having to draw a patient's blood, spin it, get the PRP isolated out of it, you can have this stable on a shelf and deliver it during a treatment whenever you want it, either as a topical or as a topical on needled skin or post-needled skin. So in the USA, this is really important. And if you remember one thing from tonight, as you start to use exosomes in your practice, these are only topicals. They do not have FDA status for anything else. So they should not be injected or in any other way used. They should be only for topicals, but you can do it in the office during needling, immediately after needling, and of course, patients can do it in their home care regimen, either on intact skin or on hair follicles or on freshly post-needled skin. So one of the great aspects of DP Derm is that they have this app store that takes full advantage of their hardware. And at least since I've been using the DP4, they have had the MG Exo Skin, which comes in a home care regimen, products to be used by the patient at home. And we're going to talk in a little bit more detail about the HLA-G protein, which I like because it's extremely low antigenicity. Probably on paper, probably even less of a inflammation response even than the patient's own platelet-rich plasma, because platelet-rich plasma has a bit of an immune response too. There's always going to be some stray red cells, and that's a long discussion, but it's definitely not completely zero inflammation. But what I want to really focus on are these MG treatment serums, which you can use in office. And they are an upgrade over the other MG treatment serums we have talked about, but these are the highest concentrations of exosomes, and they're going to run about $60 a treatment. So this is something you are going to sell as an upgrade to your patients. They do not take these home. They'll use the products at home in the upper window. And again, if you're using platelet-rich plasma, or you study platelet-rich plasma, and we talk about this in our PRP course and in our microneedling course, you will see that in the MG Exo Skin, you have a wide variety of these human growth factors, many of which that we're getting from our platelet-rich plasma. It's almost one-to-one in terms of the roster of growth factors you're getting, maybe with Exo Skin having more variety than just your standard preparation of platelet-rich plasma. So this is pretty impressive. And one aspect of these, and we're going to talk to the CEO of DP Derm USA in a minute about HLA-G exosomes, but HLA-G is a protector against pro-inflammatory change. So you're going to get, again, less scarring, less inflammation when you're using HLA-G exosomes to deliver these growth factors compared to using other exosomes that have been priorly used in the past. And what's interesting is that if you look up HLA-G on PubMed, you're going to see a lot of references to cancer cells. And so it's one of the ways that cancer cells can avoid immune system activation. So these are used by bad guys to keep the host's immune response away. Imagine how great it is when you use it for good. And that good means less scarring and less potential stimulation of pigment. So you get a much lower inflammatory response. Now, just in the last few months, they've come out with a different exosome line for scalp. And so you can use this during scalp microneedling, same thing. You're going to use it topically only, never injected. You can use it with PRP. You can use it alone. You can alternate the treatments. Right now, I'm using these MG exosome serums as a choice for the patient, either PRP or this. And this is a little bit cheaper, doesn't involve a needle stick. Some patients who want to do both might do the PRP every third treatment, might do this on the other treatments. And we'll go into a little bit more detail about these shortly with Joel Marshall. They also have a very extensive home care line. And I really urge you to go to DP Derm USA and take a look at this. The top two on the list here, the hair tonic and the Lash and Brow have active exosomes in it. The others do not have active exosomes. Of course, they're a lot cheaper, but they are still approved for use in the needled patient. And of course, in order to get the most out of scalp regeneration, whether you use PRP or not, you've got to needle the scalp. And so you have this great line of products to use on needled skin. And of course, the top two can also be used on intact skin. And I'm very eager to see how the Lash and Brow does in my first few trials of it, because we would definitely like a cheaper alternative to Latisse in our office. Couple of tips and tricks before we get to some more detailed questions. Again, it's topical only. This can save the patient about $140 versus a PRP spin. Right now, the math in my office is it's about $200 to spin PRP. Plus, I got to use the time for my nurse and the additional time in the exam room for the 10-minute spin versus $60 for just reaching for a bottle of Exo Skin on the shelf. So that's really good math for us. One important thing about exosomes, they can be quite sensitive to extremes of pH. So when you use exosomes on needled skin in the office or at home, make sure you give it a good 5 minutes to absorb before putting that next layer on. Even a lot of mild moisturizers still may be slightly acid. So we'll talk more about the course in a bit and practical CME. But I'd like to go on ahead and bring on Joel Marshall if he can activate his mic. There he is.
Hello, hello.
Hey, so
hi, Dr. Zengo. Happy New Year.
Yeah, Happy New Year to you, and thanks for coming on. And I wanted to ask you a few questions because some of these products are new, and there's a lot of exosomes out there on the market, and you know, basically, what are the differences between the Skin line and the Grow line? Because I know there was about a year and a half between the two. Is Grow a later generation of Skin, or is it parallel to Skin but just different for the hair follicle?
It's different. It's different. I mean, they're specifically designed to work with hair regrowth. So, and it's all about what you culture the stem cells with. So we do get the exosomes from amniotic fluid, from the mesenchymal stem cell there, and we'll go into the HLA-G a little bit later. But when you take those stem cells, the mesenchymal stem cells, you got to then take them to the laboratory and you got to culture them and grow them. And as you grow them, then you extract the exosomes out of there. So what you culture, because they need, just like anything, like we need food to grow, those cells also need food. So they're fed a culture medium. Now, what you culture those with can have effect then on what those exosomes will actually be targeted for. So if you look at our original Skin line, we cultured those with trophoblast cells, right? So that's actually what goes and ends up making the placenta. So they're really well designed to focus on the skin. But then when we look at the hair system, we actually culture it with healthy cells from hair follicles. So now as you feed them that and they grow and then you extract the exosomes, those exosomes are now targeted to look to regrow hair.
Excellent.
So that's the differentiation between the two lines.
Excellent. So is the source for your exosomes and the stability in the package at room temperature, are they fairly similar for both the Skin and the Grow? What kind of shelf life do we get, especially from these MG serums in our office?
Yeah, they're good for 2 years, so they are shelf stable. And what that simply means when you see there's four different ways that people end up receiving the exosomes, right? So, and people say, oh, we lyophilize ours, they should come frozen, et cetera, et cetera. So there's 2 ways which are shelf stable, and there's 2 ways which are not. So the first and probably the most effective exosome treatment would be if you take it from the laboratory and inject it straight into someone, right? So that's what they're doing in places like Korea or Japan. they're doing a lot of actually cancer treatments with them. So they culture the exosomes in a certain way to look for a certain cancer, and then they inject it straight in. So that's going to be the most potent. The next way would be to just freeze them and send them off somewhere, and then it's great, but it becomes a very expensive process, right? And really, if you're going to inject exosomes, that's probably the process that you want to do, because it's just going to be suspended in saline. Right? So if you try to suspend it in saline and then send it somewhere, those exosomes will die. Right? So you have to freeze them and keep them frozen through that whole journey. So then the two shelf-stable ways is you lyophilize them, which means you drag all the moisture out of the product or the exosomes, and then you create a powder, and then you reconstitute it with a liquid. Right? Now, recently there was a recent study showing that there was literally no live exosomes at the end of this process. So I'm not going to comment either way on that, because I can only comment on what that study showed. And the way that we do it is we actually suspend it from the laboratory into a hyaluronic acid, or a medium that the cells can stay alive in, or the EVs can stay alive in at shelf at room temperature. Right? So in that way, you can send it all across the world, and those are still going to be viable EVs when you get it as an end product. So, but you're going to have some natural preservatives in there, so that as part of that. So this is something that we then use topically, that we're generally not going to inject into the body or somewhere else.
Right. And they should behave very similar to the alpha granules on platelets and PRP, in that a minimal amount of trauma, like using it topically and then needling through it, or massaging it into needled channels, freshly needled channels, or needled channels that are still in a healing response for 3 days or so, there's going to be enough going on there to break the membrane and allow these growth factors to be released. They're shelf stable, but they're not exactly going to remain intact in every environment. And the environment we're going to put them in is going to allow those growth factors to empty, but not create the inflammatory response that then's going to detract from our results.
Correct.
So the last question, of course, is the HLA-G. And I really tried to research this on my own. And, you know, I get a lot of information in the literature about how cancer cells use it. And how do we harness HLA-G for good?
It's a good question. Yeah. Well, the reason why we do use the HLA-G protein is because of this immune resistance, or this buildup of immunity that happens when you use an EV, right? So although these EVs and exosomes, they're not a living cell, so your body doesn't reject it outright, but they still are a foreign particle. So, and the studies have shown that when you introduce these EVs into someone, there is a spike in T cells, right? So we do see that someone starts to create an immune response to the EVs. And what happens over time is they build up a tolerance to the EVs, and then they work great in the beginning, but I guess there's a tapering of the results. And over time, the exosomes don't work as well. So what the HLA-G is when a woman is pregnant, she starts emitting that protein, right? And that protein is what stops her from rejecting her baby. So that basically makes her feel that the HLA-G protein is what makes her feel that the baby is part of her. So she doesn't build up any sort of immunity or tolerance to it. So when we take our stem cells, mesenchymal stem cells, from the amniotic fluid, those stem cells are also exhibiting that HLA-G protein. So that protein is going to be in the stem cell and eventually in the EV package. So therefore, when the studies have shown, when you introduce those EVs to a person, you get nowhere near the same level of T cell spike.
Right.
So you're not building up that same immunity to it. So therefore, it should stay much more viable for a lot longer, and just a lot longer lasting product.
Yeah, that's a great That's a great explanation. And, you have two situations. You have tumor cells, again, rapidly dissolving balls of cells, and you've got pregnancy, which in a way is another rapidly dividing cells in both situations, pregnancy and tumor. And HLA-G allows those processes to go on. Of course, we don't have the bad guys in our vial of MG. We only have the protectin and the protection of the exosomes, and they're derived from, again, like you said, amniotic fluid, which is a benevolent situation. So the bottom line is these are soldiers, and they're really good at what they do, and they're able to stay out there longer and achieve their very positive effect without being attacked by the human immune system. All right, so we're at 6:30. I was going to go and take a peek at questions. I know it was a lot of information. So yeah, is it okay to mix exosome serum with Hyla active in treatment? I imagine these exosomes are solubilized in something quite similar to Hyla active, or is it a more pH balanced solvent?
Yeah, no, it's just it's going to be fine to do that, but you are just diluting the serum, so
right,
it's not going to cause a problem. So generally, the MG products, it's a 35 milligram HA, where the Hyla active is a 10 milligram HA.
Right.
So they're both still pH neutral, so it wouldn't be a problem. It's just you're diluting the product.
Yeah. So Monica, when I do these treatments, I'll prep the skin with the CliniPrep first, give that, a couple minutes to fully dry. And then I'm going to use these MG serums directly on the skin. And I'm going to invert the vial, and I'm not going to have the tip of the vial actually touch the skin, but I'm just going to drop a few droplets in the region I'm going to do. And then I will just spread it around with my glove and get it fairly sloppy wet. And that will serve as a good enough lubricant for the pen, and also stick around long enough so I can go back and massage it in a little bit more. One of the keys with any serum is that you do that second massage before you send the patient home or put the mask on at the end. You've got to do everything possible to get these treatment channels full of serum before they start to temporarily swell shut in about 30 minutes or so. All right, great. Any other questions? Of course, if y'all have questions after the fact, you can let your DP rep know, and if they can get it to me. The shelf life MJ is 2 years, and these products are being produced pretty continuously, right? You've got the hair products, the grow products back in stock, I assume, but you're going to be getting pretty fresh serum when you order it. So yeah, 2 years. So feel free to invest in especially some of the MG serums, because you'll go through them long before the expiration date, I would imagine. I generally can get 2 faces out of 1 MG vial. So that's how I do it. I'll divide the cost of the box, $600, by 10, and that gets me that $60 per treatment. How many treatments will our clients need to get the best results? Again, I think using the exosome serum, you're going to get there a lot faster. But that being said, you still want to sell packages of 4, in my opinion. And the reason for that is you've still got to have enough time for the skin to regenerate and then rest in between treatments. Because when you do these, it's complex. You're actually creating collagenase, as well as you're trying to then go and lay down new collagen. So you've got to give it time. You've got to space them out no sooner than every 6 weeks in most situations. Of course, if you're looking to treat scars, that's going to take longer than general anti-aging, glow, texture. Pigment may take a little bit longer as well, depending on how stubborn the pigment is and how good the patient is at their home care regimen. But at a minimum, you want to get that patient in for a package of 4. Because usually by the end of that 4 treatments, they will see enough results that they'll be ready to re-up. But I really don't want to sell these as a single.
Hey, I just wanted to say, for those that don't know, if you do want to ask a question, in the bottom right-hand corner of the screen, there is a triangle, a square, and a circle. If you click on that, then you can ask a question.
Can exosome treatment be done closer to 4 weeks? Yeah, you can do it closer to 4 weeks. I think if your indication is closer to pigment than it is to, say, general anti-aging, you can do it there. If it's mostly for scar, I would try and go a little bit later. Most of mine are done at 6-week intervals, unless it is strictly just pigment, and then I can do them at 4. Now, if you're yeah, so I'll leave it at that. But don't be in a rush. Don't be in a rush with this. Let those 4 treatments go over about a 6-month period, and I think your patients will be quite happy, because that's also 6 months of exposure to the home care regimen that hopefully you're going to package with your treatments, and I think they're going to be hooked by the end of that. And there's one other comment: how do these compare to placenta or fat-derived? I think you hit on that a little bit, but if you could, in your extensive research, discuss why you're not using placenta or fat-derived exosomes.
Well, if it's fat, where do you think that fat's coming from?
Yeah, I don't know. I mean, you're assuming they're adipocytes, or, I don't know. I didn't think of fat as much of an exosome producing tissue anyway.
Well, yeah, well, I mean, like well, pretty much all cells will use exosomes, but where you can find the mesenchymal stem cells, you can find them in fat. But where is the fat coming from? It's actually coming from generally someone that's getting liposuction and it's being donated, right? So you're talking about an adult that's already getting liposuction. Is that going to have the best messaging? Is that going to have the best messaging to tell a cell to turn back time?
No, it's not, because it's going to be bathed in lidocaine. Yeah. And lidocaine is acidic, so that's a problem. I was thinking maybe it came from the big chunks of abdominoplasty fat or things like that. But still, yeah.
Yeah, no, well, I mean, I can only speak for one company that I know, that because they actually say where they get it from, and it's either, I think, an 18-year-old or a 20-year-old person that's getting liposuction. So when you think about the major thing that is an EV or an exosome, it's this mRNA instruction to tell another cell what to do, right? So therefore, if it's that instruction, where that instruction is coming from is one of the most important things. Mm-hmm. So if it is coming from an adult, is that going to be as good as message as an infant, right? No, because clearly a placenta or Wharton's jelly is going to have a better message to tell a cell to rejuvenate or turn back time.
Right.
So amniotic fluid is younger again. And the advantage of amniotic fluid is that we can also have that HLA-G component as well, which you're not going to get in either placenta or the Wharton's jelly. Like those are good sources, but we use amniotic fluid as the younger source possible.
Yeah, and the only real evidence of a completely scarless surgical site is when we do intrauterine surgery, and to do shunts on for hydrocephalus, and going ahead and do the surgery and close the uterus back up, let the pregnancy go closer to term, and then when that baby's born, there is absolutely no evidence of the small surgical scar that was made for the intrauterine surgery. It's quite fascinating. And then of course, infants and children who get skin injuries heal with much less scar tissue than adults. And so, of course, that is a factor of age, and exosomes have age as well, considering where they're sourced from. All right, so let me see. I don't know if we can talk about another brand like Anti-Age if we know enough about the source. I mean, Joel, if you know anything about where Anti-Age gets their exosomes from.
Yeah, I'm not going to say anything bad about a particular brand or anything. I do know that they get theirs from a combination of bone marrow, which is adult based, and Wharton's jelly. So it is a combination of the two. So
okay.
Yeah. I won't say anything bad about them. I just, I like
Yeah.
our products, and I like what we've done by having both the in-clinic and the at-home usage as a full protocol, both for the hair and the skin.
Right. But definitely pick up some, if you're doing a lot of scalps, definitely pick up some of the Exo Grow. And of course, we're all doing faces. Just get a box of the MG and the MG Exo Skin and give it a shot. And especially to some of your patients, maybe some of your better patients who are coming back for a second package. I've done it for treatment 5 as a complimentary upgrade when someone re-ups to their second round of treatments. And because they already have experience knowing how they're going to do for the 6 weeks after the regular MG serums. And so we do that upgrade on treatment 5 at no charge and get back some good information from them. And some choose to stick with it. I just started doing that, so I don't have a lot of data yet. But that's one way to do it. But definitely get it and add it to your armamentarium. And it's really cool, and it's causing a lot of dust on my PRP centrifuge, which is fine because those kit orders are big dollars. All right. Well, sorry we went a little bit over, but this is a really cool topic, and it's always changing. And so pick up the CME course, and you will be plugged into everything new in microneedling and exosomes and topicals for the next 2 years. Thanks to Joel for joining in and helping.
Thank you.
And we will be back in 2 weeks to talk about the importance of FDA status. And otherwise, have a great night and stay warm. And we'll see you in 2 weeks on the 29th. Good night.
Thank you. All right. See you, Dr. Zengo.
Bye. Good night.
Bye.